Now, if you are living with chronic pain, you know how debilitating it can be, and there is some relief for you out there. The doctors from the Arizona Pain Specialists can help, and Dr. Paul Lynch is back along with a new doctor to the practice, Dr. Jonathan Carlson. It's good to see you, Dr. Carlson.
Thanks for having us today.
Absolutely. We were just talking earlier, your practice is growing and growing and growing, so the need for more doctors. And tell us about your background.
Well, double board certified in anesthesiology and pain management. I was fortunate to train at the same practice as Dr. Lynch and Dr. McJunkin at Texas Tech. What's nice about it is that some of the fathers of pain medicine were based out of there, Dr. Gaborax and Dr. Preethi Raj. And I actually trained primarily with Dr. Rax, and I got to see him treat patients from literally from all around the world.
Wow.
And it wasn't just back pain, it was also facial pain, abdominal pain, pelvic pain, and it was just such a privilege to train under a mentor like that.
And now here you are as part of Arizona Pain Specialists here in Arizona.
Yes.
And people, as you mentioned earlier, might be wondering, Dr. Lynch, you talked about chronic pain, but it's not just chronic back pain, it's all kinds of pain, and it's all under one roof, which is really important.
Yeah, I think that's part of the approach that we've really tried to bring to the Phoenix market, is that no matter if you're having back pain or headaches or shoulder pain, under one roof we can treat any type of pain that you have. And we had such a need for more pain doctors in the Glendale market, and we would get phone calls all the time of when are you guys going to be in the West Valley.
Right.
We started our Glendale office last year and have grown extremely fast. Dr. Carlson has joined Dr. Hogan on the west side, and we're seeing hundreds and hundreds of patients a day on the west side. Dr. Carlson is a great addition to our team because of his training. He's an interventional specialist and can really treat pain throughout the entire body. So it's worked out really well. We love having him. And he joins chiropractors, naturopathic doctors, and behavioral therapists all under one roof to provide a comprehensive approach.
Yeah, and that you said that was part of the reason, obviously, why you chose this practice, because of the history of who has been there before, how it started.
Yes, I actually interviewed at practices and looked at practices in Arizona, California, and Hawaii. And the best thing I liked about Arizona Pain Specialists is I thought it was the most in sync with my philosophy and my approach on treating chronic pain. Again, the comprehensive approach was a large draw. I felt that treating patients with this approach would be the best to help get them better with chronic pain. Another reason why I joined though is because of their research, and they also had a nonprofit, their Arizona Pain Foundation, which is something that I was really excited about because I've done a lot of mission work and humanitarian work, and they were a practice that wasn't just interested in treating patients medically, but also helping those in the community.
Wow, so when you go to Arizona Pain Specialists, not only are you going to a place that's all under one roof, but you're going to doctors who, they chose that practice. This is you're choosing it too. You chose to be here, wanted to be here.
Absolutely.
Now you have a big event coming up in December, so let's talk about that as well. That's for the nonprofit?
Yeah, Lisa, if if some of the viewers are watching and they want to get involved, part of what we have is the Arizona Pain Foundation. We give 5% of all the profits we make at our center to the foundation, and what we try to do is support both local people who are underprivileged and also overseas. We're doing an event in December with local refugees. We're doing a Christmas party. We're going to give toys to children who wouldn't have a Christmas otherwise. And if you want to find out more about that, you can go to our website, which is arizonapain.com. We have an outreach section. You can see about some of the people that we support locally. And if you want to be involved, you can just call our center, and the people who answer the phone will be able to help you with it.
Okay, and Dr. Carlson, you'll be at the Glendale office, is that right?
Yes.
There's two offices right now, right? One in Scottsdale and one in Glendale.
Yeah, we have one in Scottsdale and one in Glendale, and the growth has been pretty tremendous, Lisa. We'd say with all due respect, because we're just trying to help the people that are suffering, but we've grown so quickly over the last year. It's been around 600% growth in our practice.
Wow.
So we have Scottsdale and Glendale now, but we're looking at 2 other locations in the next 12 months, including possibly the East Valley, where there's a lot of patients that we could help there as well.
Yeah, I think people, they spend their daily life not even realizing how much pain they're in. And I think quite frankly, it's hard to go here and then go there and then go, and you have it all in one place. You can get all the treatments you need, whether it's acupuncture or steroid shots, whatever it might be, and you can treat that person in one place, which is key for a lot of folks.
One thing I wanted to be able to say to your viewers today that I think is important is that, we provide hope where other doctors have told them there's nothing they can do, whether it's face pain or back pain, whether they've had surgeries, that we really provide hope. We have an entire research department devoted to finding new solutions to pain where other doctors have said there's nothing we can do. We'll say we'll try.
Yeah, and you had said earlier too that the treatment of pain is still fairly a new thing. You said like in the 90s, right?
It really is.
Yeah, that's specifically what you treat. You go to your regular physician and they don't know how to just treat pain.
You know, 15 years ago, if you went to your doctor and said, you know, I have abdominal pain, they might do 1 or 2 tests and say, there's nothing we can do for that, and maybe give you a medication, maybe a pain pill that just masks the pain. But today we have entire specialties devoted to the eradication of pain management. When I was in medical school 10 years ago, I literally had no idea that this was an option for the rest of my career. And it wasn't until towards the end of medical school that I even found out that this was an option.
Yeah, so for those of you watching who think, you know, I've just given up hope, they told me there's nothing more they can do, there is some other solutions for you to check out. You might actually be able to get rid of that pain. Thank you both for joining us.
Thanks
and
for
congratulations. Welcome to Arizona and Glendale. Good to see you.
Yes.
And if you do want any more information on Arizona Pain Specialists, you can go to arizonapain.com. There's a phone number right there on your screen.